Every year, dangerous medication combinations send 1.5 million Americans to emergency rooms. The FDA's own adverse event database has logged over 14,000 deaths specifically caused by drugs interacting with other drugs. Many of these combinations involve medications you can buy without a prescription. Pills that sit in nearly every medicine cabinet in the country. One combination on this list has been linked to over 118,000 deaths in 2 decades. The FDA had to issue its strongest possible safety warning, and doctors are still prescribing both drugs together. Stay until the end because that combination involves 2 of the most commonly prescribed drug categories in American medicine. You almost certainly know someone taking both right now. Before we begin, tell us in the comments how many prescription medications you currently take. Now let's start with number 5. Number 5. Metformin and contrast dye used in computed tomography scans. The concern is straightforward. Contrast dye can temporarily impair kidney function. If your kidneys slow down while metformin is still in your system, the drug can accumulate and trigger lactic acidosis, a condition that historically carried a mortality rate near 50%. But here is where the evidence gets interesting. A 2022 meta-analysis published in Cardiology followed over 2,000 patients and found 0 cases of lactic acidosis in metformin users who received contrast dye. The Cochrane review pooled over 70,000 patient years of metformin use and found the same result. Walter, a 64-year-old electrician from Phoenix, was told to stop all his medications before a routine scan. Nobody explained which one mattered or why. He skipped everything, his blood pressure spiked, and the procedure was delayed a week. The American College of Radiology now says patients with adequate kidney function do not need to stop metformin at all. The entire safety net is one conversation. Tell every imaging provider you take metformin. Let them check your kidneys. But the next combination does not have such a simple fix. The FDA had to issue a direct contraindication. Number 4. Statins combined with clarithromycin or erythromycin. 92 million Americans take statins. Macrolide antibiotics are prescribed constantly for sinus and respiratory infections. Both drugs compete for the same liver enzyme. The antibiotic blocks that enzyme, statin levels in the blood skyrocket up to 10-fold, and muscle fibers begin breaking apart. The condition is called rhabdomyolysis. Destroyed muscle tissue floods the kidneys with toxins. A landmark study in the Annals of Internal Medicine followed 144,000 statin users. Those prescribed clarithromycin had a 78% increase in acute kidney injury and a 56% increase in death within 30 days. Margaret, a 71-year-old retired bookkeeper from Columbus, was prescribed clarithromycin for a sinus infection. Nobody asked about her statin. 5 days later, she could barely climb the stairs. Her urine had turned dark brown. She spent 11 days in the hospital with kidney function at 20%. The fix is simple. Azithromycin does not block that enzyme. If your doctor prescribes clarithromycin, ask whether azithromycin would work instead, and always mention your statin. Now, number 3 involves a combination that can stop your heart. And the story behind it is one of the most disturbing examples of good research going wrong. If you are finding this helpful, hit subscribe. We cover health and safety research every week. Now, let's talk about number 3. Number 3. ACE inhibitors combined with potassium supplements or potassium-sparing diuretics like spironolactone. ACE inhibitors naturally raise potassium levels. Add a supplement or a potassium-sparing diuretic on top, and levels can climb into territory that disrupts the electrical signals keeping your heart beating. The American Heart Association has stated that of all electrolyte abnormalities, hyperkalemia is the most rapidly fatal. When potassium exceeds 7.0, the odds ratio for death reaches 88.6. In 1999, a major trial showed that adding spironolactone to ACE inhibitors saved lives in carefully selected heart failure patients. Doctors everywhere started prescribing the combination. But a follow-up study in the New England Journal of Medicine found that hyperkalemia deaths climbed 6.7-fold. In Ontario alone, researchers estimated 171 excess deaths in a single year. Nearly a third of patients receiving the combination would not have qualified for the original study. George, a 70-year-old retired bus driver from Cleveland, had spironolactone added to his lisinopril. His potassium was never rechecked. 6 weeks later, he collapsed in his kitchen. His potassium was 7.4. He needed emergency dialysis and 4 days in the cardiac unit. If your doctor prescribes both, ask when your potassium will be rechecked. It should be tested within 1 to 2 weeks. And never take potassium supplements or salt substitutes without asking first. Next, number 2. This one involves a prescription blood thinner and a pill you can buy at any gas station. Warfarin combined with ibuprofen or naproxen. Warfarin slows clotting. Non-steroidal anti-inflammatory drugs thin the blood through a different mechanism, and they irritate the stomach lining at the same time. A 2020 meta-analysis in thrombosis and hemostasis found the combination nearly doubles the risk of gastrointestinal bleeding. A Danish study of over 51,000 patients found naproxen quadrupled the bleeding risk in warfarin users. Centers for Disease Control and Prevention. Affiliated data. Estimate roughly 254,000 emergency visits per year for anticoagulant-related bleeding. 1 in 4 people on warfarin also take a non-steroidal anti-inflammatory drug. Many bought ibuprofen over the counter without anyone asking what else they take. Rose, a 76-year-old retired piano teacher from Cincinnati, had been on warfarin for 3 years. One morning, she took 2 ibuprofen tablets for a stiff knee. She did it again the next day. On day 4, she noticed her gums bleeding. By that evening, she was in the emergency room with internal bleeding in her stomach. The better option is acetaminophen sold as Tylenol. It manages pain without the blood thinning effect. If you take any blood thinner, put a note inside your medicine cabinet. That one step could prevent a trip to the emergency room. And now we have reached the most documented, most deadly, and most preventable combination on this list. Number 1. Opioids plus benzodiazepines. Both drug classes suppress your central nervous system. Opioids slow brain activity to relieve pain. Benzodiazepines such as Xanax, Valium, and Ativan reduce anxiety through a similar mechanism. Together, they can slow your breathing until it stops. On August 31, 2016, the FDA issued a black box warning on nearly 400 products. Combined use risks extreme sleepiness, respiratory depression, coma, and death. The numbers are staggering. Over 118,000 overdose deaths that involved benzodiazepines occurred in the US between 2000 and 2019. More than 83% also involved opioids. A study of 2.18 million opioid patients found the overdose death rate was 10 times higher among those also taking benzodiazepines. A veteran study of over 400,000 patients found the combination nearly quadrupled overdose death risk. Despite the FDA warning, so prescribing only dropped about 18%. Among veterans on opioids, 27% also received benzodiazepines. David, a 58-year-old construction foreman from Indianapolis, was prescribed oxycodone for a back injury. A different doctor had already prescribed Xanax for anxiety. Neither knew about the other prescription. He filled both at different pharmacies. His wife found him unresponsive on the couch on a Tuesday evening. If you take both, talk to your prescriber about alternatives. Buspirone, hydroxyzine, and certain antidepressants treat anxiety without the respiratory risk, and make sure every doctor you see knows every medication you take. 5 combinations, each one backed by real studies, FDA warnings, and patients who had no idea what was happening until it was almost too late. Every single one is preventable. Do one thing today. Pull out every medication you take, including the over-the-counter ones, and make a complete list. Bring it to your next appointment. Hand it to your pharmacist. That single piece of paper is the strongest safety net in medicine. Subscribe so you know before your next prescription.